Thank you for that. The Premier's press conference has just ended. There was some very somber information that he put out today with respect to what's going on in long-term care. I don't want to downplay anything that he spoke about. I'm happy to answer any questions that anyone may have about that. The focus of our press conference today is not necessarily on those numbers for long-term care or the results of the report from the military. A couple of things I would like to talk about, though, and we'll try to keep it as brief as possible. I'll try to keep it to about 8 minutes or so. We have embarked on a number of different initiatives to try and increase the number of people that are being tested for COVID-19. Locally, we have a good test percentage here in the Peterborough-Kawartha area. Those numbers could be higher. We have capacity for about 100 tests per day. We have not been at that mark in quite some time. In fact, I believe yesterday was the high water mark number of tests that have been done in this area. It was a little over 90. We have not been near that number for quite some time. We have asked the public if you want to be tested, if you believe that you might be infected, then please go and get tested. With public health, they have asked that people reach out and try and set up an appointment with them to do the testing. There's a couple of different reasons for it. First of all, we don't want to have a number of people who are potentially COVID-19 positive all standing in line together because the risk of infection, passing that infection on to others who may not be positive while you're standing in line waiting is a little bit higher. If you do it by appointment, then we can ensure that everybody is going to be very safe. If you believe that you are COVID-19 positive, you believe you have the disease, there's certain criteria that public health will put out or ask questions of you. And if they believe that you truly are sick that way, they'll send the paramedics to you to reduce the risk. That can't happen if you just show up at the testing center. So locally, we're hoping that it can be done in a fashion that is as safe for as many people as possible. But we're happy to test as many people as people think they should be tested. We also have an initiative province-wide called Small Businesses, Big Hearts. What we're looking for from this is anyone who knows of a small business here in Peterborough-Kawartha who has been helping with COVID-19, who has made donations, who's reached out to different people, who've done above and beyond. We're asking that you pass that information on to us. There's an award that the Premier has come up with for it, and we'll be looking to celebrate all of those good things that our local small businesses have been trying to do. We hear on the news a lot about the large companies who are making multi-million-dollar donations. Bruce Power, for example, who has donated a little over 1 million masks. That's a great thing. I don't want to downplay it whatsoever. But we also have to take into account that we've got some of these smaller businesses, people who had been supportive of local sports teams, who had made donations to different charities, who have done so many small things to make a positive impact in our community. And they're stepping forward now with COVID-19, even under the strains that they currently have financially themselves. And they're still reaching out to do what's right for our community. We want to celebrate that. So if there's anyone at all who has gone above and beyond, please call my office, send us an email, send us a text, let us know over Facebook or Twitter. But let's celebrate all of the good things that are being done by some of our small businesses. We announced this week a new rapid research fund and the first 15 recipients for it. All of these things are based around COVID-19, obviously, different testing techniques. One I want to point out in particular is the convalescent plasma. There is a program, a thought process that someone who has already beaten COVID-19, that they have the antibodies in their system. And it's worked with other diseases where they've taken plasma, one of the elements of blood, from people who have had the antibodies in their system. They pass it on to someone who is fighting a severe infection, and it helps build their own immune system. It helps fight that off. So I wanted to point that one out in particular because that could be one of those life-saving things that helps a lot of people if they get a severe case of COVID-19. The Canada Emergency Commercial Rent Assistance Program. The application process opened today. We have been waiting for this to open up for quite some time now. A number of changes have been made to it over the past month. That's what has caused the delay. When it was first announced, it was based around landlords, and it was about getting the landlords some money, but not covering their profit. As we have gone through that process working with the federal government, we found that there were a lot of tenants that were going to be left behind by this, the way that the system was originally designed. Working with our federal counterparts, we've made some significant changes to the program. It's now focused on the tenants, not on the landlords. The landlords still have to apply for it. It's not the tenant that applies for it because it's being administered through CMHC, but it is based on the gross rent that the tenant pays. That means then that if you're paying $1,000 a month for your base rent and you're paying $500 a month for taxes, maintenance, and insurance as part of your rent, that whole $1,500 amount would qualify then under the new program. We're looking forward to being able to help a number of tenants get through this, commercial tenants, get through this over the next couple of months with it. If anyone has any questions about it, if landlords aren't sure about how to fill out the process, we're happy at my office to help with it. It is open now through CMHC, but we're happy to do whatever we can do to try and get that rent relief for those commercial tenants. We also want this is going to help our apprentices get out there and help with getting the economy going again. We also had an announcement for a virtual action center. Those who are working in the hospitality industry have been hit the hardest with it. There is one report that almost 90% of people who are working in the hospitality industry have been laid off as a result of what's happened with COVID-19. The Virtual Action Center will provide supports for approximately 2,000 people who are working in, or who did work in the hospitality industry. This should relieve some of the pressure that those individuals are feeling as well. We are just over a week now into phase one of reopening the Ontario economy. Last week, we saw some higher numbers in terms of the infection rates. We touched over 400 on a couple of days. Today, the numbers are down a little bit. We are below 300 again today. So those are promising numbers. What I think we saw was a rise in infections because of the Mother's Day weekend. A number of people, we believe, went out, they celebrated with their family for Mother's Day. They weren't following some of the social distancing guidelines. And in the end, what we saw was an increase in infection rates. Please do not be surprised if we see numbers going up again over the next week and a half to 2 weeks. We had the May long weekend. We have opened things back up again for phase one. And there is an expectation that there's the possibility of our numbers going up a little bit. We're hoping with all of the measures that have been put in place, with practicing social distancing, wearing face masks where you can't practice the social distancing, continuing to wash your hands and sanitize. We're hoping that we'll be able to continue through this and we'll get to phase two as quickly as possible. I'm happy to answer any questions that anyone may have. If you could raise your virtual hand for me, happy to answer any questions.
I gotta raise my real hand.
Okay, go ahead, Lois.
So you said this is Virtual Action Center, 2,000 people. Is that in your writing?
That's across Ontario. It's with respect to the Unite Here union. They are the ones who will be running it for us. The Unite Here is the union specifically for hospitality workers.
Okay, so the people get in touch with their union then?
Yes.
Okay, thanks.
Any other questions? Jessica, I'm going to send you a note here. Chat. I see that you can't get your audio to work. I'm asking if you have a question, and you can put it into the chat for us. I'll give her a second for it. And it doesn't look like we have any questions from Jessica.
Okay.
Thank you very much, guys. I really appreciate this. We'll be back at it again on Thursday. Thank you.